You're listening to Up1Notch, a podcast where I explore the tech business world. My name is Mohammad Aoun, and I'm a growth accelerator for tech companies looking to scale their businesses. I'm sitting down with software industry leaders, startup founders, and tech experts. Tune in to hear about the latest and greatest from the tech world. Hello, everyone. Thank you so much for tuning into another episode of Up1Notch, a podcast where we talk about business and technology overlapping areas. Today, my guest is Kesh from Solutions for Health. Hi, Kesh. How are you doing today?
Hi, Mohammed. I'm good. How are you?
Absolutely great. Thank you so much for asking.
Thank you for having me.
Absolutely. Okay, so why don't we start off with a bit of introductions? Obviously, you've been involved with a number of things. You started off, I guess the company started off as a non-tech company, but then you kind of moved towards the technology aspects of it, right? So we're going to be talking about a lot about healthcare and everything, and specifically in relation to the tech. But let's start off with a bit of introductions, and then we can take it forward from there.
Okay, yeah, sounds good. So, me personally, I've always been interested in philosophy and technology, really. So, not theology or questions around semantic philosophy, but what I've really been interested in is eudaimonia and flourishing and just how we can live a good life. And I was growing up when social media was emerging and Facebook was growing and the iPhone was out, and at the same time, my parents, Keisha and Lena, started a company called Solutions for Health, and it really all begun when my mum was a stop smoking advisor in 2003, and was really driven to help people stop smoking and to live better lives. And in 2008, my parents set up Solutions for Health, and it started off as a stop smoking company. So these would be physical stop smoking services, and has now grown to provide a range of different clinical and lifestyle services. So we are predominantly a CQC regulated provider of lifestyle clinical services. So these are direct to consumer services in the UK. So these are NHS services that are free for people to use and paid for by kind of local authorities in the NHS. And these include stop smoking services, weight management. We provide support for autism. We do nursing services, and we do sexual health services. And we have about 600 fantastic staff members who provide these services. And a few years ago, my dad, Keisha, CEO, said to me, why don't you build a stop smoking robot, join me and build a stop smoking robot? And I was like, well, would you mean a stop smoking robot? So he had faith in my abilities to be able to execute on this. And we had a discussion about rising demand of stop smoking services. It's really interesting how actually, even though the stop smoking, the smoking prevalence has actually gone down, the demand for stop smoking services has actually increased. And it's getting really difficult for the NHS and local authorities to be able to continue paying for evidence-based and sustainable stop smoking services. And there's been a need to be able to provide this kind of scalable evidence-based support for people. So that's why we built Bella. So Bella's a stop smoking robot. We had already had about 10 years of experience helping people to quit smoking. So had consequently amassed significant insights and expertise on how to help someone quit smoking. And we used that alongside the insights from our 200 stop smoking advisors. And we built a stop smoking robot, and that's helped thousands of people now to give up smoking. It's being used in about 20 different areas across the UK, and has really supported not only physical stop smoking services to improve their efficacy, but also reach out to people who may not have engaged with traditional stop smoking services. And we've really gone on since then as well to produce other well-being apps. We've got apps for early years. So we've got an app, a robot that helps parents with a child between 0 and 5 to help them with all the questions that young parents and young families have to face and deal with. And we've got an app for children between the ages of 5 to 10, and that helps them to teach them about how to be healthy, and covers we take a holistic a holistic approach to well-being. So the kid learns about how to not only eat right and exercise, but about their mood, about sleep, about hygiene. And we've got an app for teenagers, and also for adults, and to help them to make healthy habits sustainable. And most recently, which we're most excited about, is Happy. We've only gone live. It's only been 2 months since we've gone live with that. And that's really an all-round well-being guide to help people to really experience a deeper sense of well-being, and to help them to be overall much healthier and happier. So we're still, predominantly a healthcare services company, and we've kind of started this tech division to be able to provide services at scale.
Right. So thanks for the introduction there. So you spoke at least like 4 or 5 different use cases of how the technology could kind of impact, like, for example, people looking for weight control, people looking for help in the early years, the children in the early years. And then I think in one of our previous conversations, you also mentioned autism and everything. What does it really look like to market such a solution and get people to start using it? What are the dynamics of, let's say, building a product like that and then get people to use that?
I think the first place to always start off from a kind of technical and business point of view is the problem. So if technology and AI is the solution, what's the problem? And to be really focused on the issues that customers and people and users face. And once we look at that issue, we can see how technology can help. So one of the biggest challenges is accessing good quality services, and this can range for different people, for across different sort of areas. So it could be accessing a good quality smoking service, or support for autism and ADHD, support to be able to lose weight, or to be able to talk to someone who can help with questions they have with their young child, especially for families who are kind of going through that for the first time. And that's where we focused our technology. So not only we've tried to make our technologies accessible for people. So we really believe that you've got to meet people where they are, and increasingly that's on the smartphone now. So there's obviously a range of different ways we can meet people. We can have smart speakers, we can reach them on televisions, we can reach them in different places, but most of the time people access the internet and technologies through their smartphone. So being able to kind of build an app that's accessible on iOS and Android is really important. And then from there, how do you provide a service that is evidence-based? So we work with healthcare experts, and we work with service users, and that's really important to be able to build a service that's actually evidence-based. I see a lot of companies nowadays, they're just engineers, or they're just designers, or they're just entrepreneurs, and they're building either something in healthcare or something is that can help people to be happier or healthier, and they're not always talking to subject matter experts, and we think that's really important. Synthesizing insights from different areas. It could be neuroscience, positive psychology, nursing, talking to the doctors, the mental health practitioners, the nurses, who actually really know how to run the service, and taking their insights and then making that accessible really through design, and through obviously appropriate kind of marketing, and then reaching people who may not have really traditionally engaged with either technology services or even the physical healthcare services.
Right. And how hard was it to kind of obviously explore and go down this route of developing digital products? Like, obviously, you said it right. We understand where the problem really is, and then you reverse engineer and see how the technology can really help solve that problem, right? So we identified, for example, okay, smoking is a huge problem. Let's try to resolve that. or impact it in some positive way. Autism is a huge area where, let's say, people need help in early years, they need help, and similarly with the case of elderly as well. But when it comes to developing a digital product, it's an entirely different ballgame, right? So how did your journey evolve? Like, for example, finding the partner for it, developing the designs, developing how the application would flow from one screen to the other, the development aspect of it, the QA aspect of it, and then the marketing finally. So tell me a little bit more about your journey through the development process of these digital applications.
Yeah, so the process is can be quite challenging, actually. Really, it's something that I would encourage others who maybe are looking to get into it or who are already going through it to really kind of think carefully about, especially in those early stages when they're thinking about the concept and they're thinking about the design. And I'd really urge people, something that we smash through a lot of brick walls, and after a while you notice where the doors are. And we started to see how it's so important to involve users really early on in the process. It's important that you don't just have a development team that is focused on building something without talking to end users. It's a mistake that everyone can make really easily. They're focused. They're in their own teams. They're in their own sorts of kind of ecosystems, and they build something and they think when it's finished we'll get it out and we'll see what happens. But finding product market fit is just incredibly challenging. And it's not necessarily a case of resources either. I mean, it's I know there's a lot of people have different views on Mark Zuckerberg, and there's some people who really like him, some people who absolutely hate him. But it's interesting to see that a company like Meta with a product like Facebook have somehow pivoted away from our product market fit. There's people are using Facebook less now, and it's interesting that even if you have essentially all the money in the world, you can still somehow struggle to find product market fit. And so it's not just a case about resources. It's about thinking clearly, making sure you engage with users and you build stuff that people actually want to use. But in healthcare, sometimes it's not as simplistic as maybe other areas of tech, where you can build things and if people use it, that's the only thing that's important, right? Because you can sell them ads. That's not the case in healthcare, where you actually have to build something that's effective, that can actually help someone to be healthier or achieve the goal that they're looking to achieve. So in our case, it's not necessarily about keeping a user on our products for as long as possible. We just want to help them achieve their goals. It could be smoking, weight management, being healthier, being happier. But the aim is to to help people achieve their goals. And obviously for different companies, that aim could be slightly different. But that's really what we've tried to do. So in the kind of development process, involving users early on, and making sure that we're also involving subject matter experts and building something that actually works is really the first aim, and never to really rush this in a way. I know a lot of companies would be pressured to get something out there quickly, but actually if the problem you're trying to solve is worthwhile and it's meaningful and it's a big problem, it will tend to be there in a matter of 3, 6, 9 months, and probably 10, 20 years. It's just the idea of being healthier and happier is something that human beings have always tried to do. I mean, we've come a long way in a short space of time. I mean, in the 1930s to the 1950s, doctors were recommending smoking, and you'd go see your doctor and they'd be like, I know what's wrong with you, you're not smoking enough, right? It was a crazy time. And if you were running, people were like, well, why is that strange person running from? So we have come a long way over a short period of time, and especially now people are really concerned about their health. They want to improve it, and also just trying to be happier. That's what a lot of people want to do. So taking your time to build a product that's actually worthwhile, that's the hardest part. Actually kind of creating that fire, finding product market fit is the most challenging part. But then once you've got that, you can scale up, just kind of pour gasoline on that fire and spend those marketing budget and kind of scale up.
Right. So two very interesting points. One was the helping people achieve their goals, whatever the goals are. If they feel that smoking is, would you agree that if, let's say, people want to kind of, I mean, people also do smoking for, let's say, for the case of, let's say, to get socially accepted as well, right? That's a norm as well, why people typically start smoking as well. So whatever the goal is, to help them achieve that. And then the other part is that finding the product market fit. And that was a very interesting point about Facebook, that with all the resources, with all the money in the world, you could still struggle to kind of find a product market fit. So what exactly helps you kind of find that product market fit? What are the KPIs? What exactly do you look for when, let's say, you feel, okay, this is the product that we want to build. This is the market that we want to tap into. What exactly are we looking for? What are the signs and symbols for that?
So what we try to do really is to kind of take it step by step. So for instance, on our latest product, Happy, your wellbeing guide, which is kind of available on the App Store and the Play Store. And what we're trying to do there is to help people to not only be healthier, so there's a quiz they can learn about their health and learn about how to improve it, but that we've also got other sections there to help them experience a deeper sense of well-being. And this was something that was quite new. I mean, there's other sort of kind of mental health apps out there, but what we were trying to do was really integrate the physical and mental health and to help people to not just be calm or to stress less, but to really be able to kind of transform their experience, and trying to find product market fit on that. And the way we've been testing it really, again, is to take it kind of step by step. So the aim is to get firstly about 50 people who really like your product, who can say that, yes, I like this, I would use this, and this has already been helping me. And we want to grow with our users. So it's not a case of, let's try to get to 100,000 or 500,000 users as quick as we can. And some companies, maybe the way they're funded, have different sort of pressures and tensions. But what we've tried to do is firstly get a core group of people who actually enjoy the product, who find it's helpful, it's beneficial. We learn about how they interact with it. We learn about what they actually use it for. So it's interesting. We have a memory bank section where there's initially it was thought to help people to kind of based on reminiscence and validation therapy. You can upload your memories and you can recall them and relive them at any time, and that's supposed to kind of usually used in the context of people who suffer with dementia, but can really be used for the general population. And then suddenly we found people actually using that not only for that reason, but to also back up their memories and to kind of use it as a backup of some of their favorite moments. So you learn about kind of you have an intention with the product, and then you see how people engage with it, and there's different ways in which you can kind of help people with that. So yeah, finding a core group, around 50 people who actually go, yeah, this is something that's good. It helps me, and I'd use it. I paid for it. I would pay for it. I think that's the key.
Right. And interestingly, that reminds me of that video I saw of Jeff Bezos. So he mentioned about, in relevance to that product market fit, he mentioned two startling statistics. Number one, he said that when I started off Amazon, it was like I actually came across this startling statistic that the internet back in like 1996 or 1998, whatever the year was, that the internet is growing at the pace of 800 times or 600 times every single year. So that shows that the internet is obviously going to get adopted hugely across the world. And then the other thing he identified was that basically out of all the products, books is the category which essentially has a lot of and most categories than any other products. Like, for example, it's got fiction, non-fiction, biographies, horror, comedy, things like that. So based on these two statistics, he started off Amazon as a bookstore and then started off building from there into and diversified into many other, obviously, as we know, into category. But that really identified kind of what the product market fit is, right?
Yeah, absolutely. I think it can be really worthwhile to kind of pay attention to obviously the market you're in, to see what not only competitors but how consumers are kind of behaving. And sometimes though, I think that can be a distraction for maybe companies who have just started or they're just building something. Sometimes they can try to back up and validate their idea by saying, look how big the market is, look at what our competitors are doing. But what really matters is how you customers and users use your product. It's not just as straightforward as saying, well, there's other either meditation apps or there's other companies who are doing something similar. You could take an e-commerce example and go, look, Amazon have done it, so we're going to do exactly what they've done. It's actually, it can be certainly very validating for the kind of market and business model, but in terms of actually customer adoption, that's really the most important thing. Do people want to use your product? And when they use it, do they enjoy using it? Will they come back? Will they keep using it? Will they pay for it? Are you actually serving those users and customers? I think that's really always the kind of the most important thing, really, to start small and then to build up and start thinking about other things.
Absolutely. So, well, that was really some interesting points that we covered about, like, for example, starting off from the healthcare side, and then we talk about the technology element of it, and then product market fit. Thank you so much, Kesh, for taking the time out for this podcast episode. I really enjoyed the conversation.
Thanks, Mohammed. It was great talking to you.
Thank you.